Hello everyone, this is Dr. Shweta Anand and welcome back to my channel Simplified Dentistry. So today let's have a look on Oral Hygiene Index. So Oral Hygiene Index was developed in 1960 by John C. Greene and Jack R. Vermillion to classify and assess oral hygiene status. So Oral Hygiene Index comprises of two components, which are debris index and calculus index. So, debris is a soft foreign material loosely attached to a tooth surface and it can be easily removed. Whereas calculus is a hard deposit that is formed by mineralization of dental plaque on the surface of teeth and it cannot be easily removed. Now let's know about the method which is used to calculate oral hygiene index. So, we have to divide our oral cavity into 6 segments, that is 3 segments in each dental arch. You all must be knowing that our mouth is divided into 4 quadrants. So here, in spite of 4 quadrants, we have to split it into 6 segments, not quadrants. Okay, so the first 3 segments will be in maxillary arch and the last 3, that is 4 to 6, will be in mandibular arch. So, as the maxillary right is first quadrant, so in the same way, right maxillary portion is mentioned as segment 1 and then we have to move in a clockwise direction. Now let's have a look on each of these segments. So segment 1 is distal to the right cuspid on the maxillary arch, which means that segment 1 consists of right maxillary premolars and first and second molar. Okay. Segment 2 is mesial to both the right and left first bicuspid on the maxillary arch. So basically, segment 2 consists of all the maxillary anterior teeth. Now segment 3 is distal to the left cuspid on the maxillary arch, which means that segment 3 consists of left premolars and first and second molar. Now in the same way, it is divided for the mandibular arch. Okay. So segment 4 is distal to the left cuspid on the mandibular arch, which means that it contains the left mandibular premolars and first and second molar. Now again segment 5 is mesial to the right and left first bicuspid on the mandibular arch, which means that it contains all the mandibular anterior teeth. Okay. And at last segment 6 is distal to the right cuspid on the mandibular arch, which means it contains right mandibular premolars and first and second molars. So each index is based on 12 numerical determinations representing the amount of debris or calculus found on the buccal and lingual surfaces of each of the 3 segments of each dental arch. So, for example, if we have to calculate the debris index, there will be 12 determinants for that. That is, there will be a single tooth from each of the segment and we have to consider both the buccal and lingual surface of each tooth, that is 2 surface of a single tooth. So 6 segments means 6 teeth and 6 into 2 surface, that is 12 determinants. Now let's have a look on the rules which must be kept in mind while measuring oral hygiene index. So first is only fully erupted permanent teeth are scored. So if there is a partially erupted teeth, then we have to ignore it. Second is third molars are not included. So even if third molars are present, we have to not include it. Third is from each segment, only one tooth is used for calculating the individual index for that particular segment. And fourth is the tooth in a particular segment used for the calculation must have the greatest area covered by either debris or calculus. Now let's have a look on the procedure. So for the debris index, the surface area covered by debris is estimated by running the side of a number 23 explorer, that is Shepherd's hook, along the buccal or labial and lingual surfaces of the tooth. Calculus index is also measured in the same way by number 23 explorer, which is used for estimating the amount of supragingival and subgingival calculus. One thing should be kept in mind that oral hygiene examination and scoring for debris index should always precede the oral examination and scoring for calculus index. Because calculus is hard as compared to debris, so if you have not calculated debris index before calculus, then while removing the calculus, the debris will also be removed and you won't be able to calculate the debris index. So, for debris index and calculus index, the sequence of oral hygiene examination should proceed according to the segment, and in each segment, facial and lingual surfaces should be measured. That is, we have to start from the segment 1 and then move on to the other segment, and in each segment, both the surfaces of the teeth are considered, that is, for the posterior teeth, buccal and lingual surfaces are considered, whereas for anterior teeth, the labial and lingual surfaces are considered. Now let's have a look on the criteria and scoring for debris index. So score 0 means no debris or stains present. Score 1 means soft debris covering less than 1/3 of the tooth surface is present, or there is the presence of extrinsic stains without other debris regardless of surface area covered. Score 2 means that soft debris covering more than 1/3 but not more than 2/3 of the exposed tooth surface. And score 3 means soft debris covering more than 2/3 of the exposed tooth surface. Now let's have a look on the criteria and scoring for calculus index. So score 0 means no calculus is present. Score 1 means that supragingival calculus covering less than 1/3 of the exposed tooth surface. Score 2 means supragingival calculus covering more than 1/3 but less than 2/3 of the exposed tooth surface, or there is presence of individual flecks of subgingival calculus around the cervical portion of the tooth, or both. And score 3 means supragingival calculus covering more than 2/3 of the exposed tooth surface, or a continuous heavy band of subgingival calculus around the cervical portion of the tooth, or both. Now let's have a look on the calculation. So the buccal or labial and the lingual scores are tabulated and summed up for each segment and each arch. And then the debris and calculus scores are tabulated separately and the indices for each are calculated independently. So, for an individual, debris index is equal to the buccal total score and lingual total score divided by the number of segments scored. And in the same way, calculus index is equal to buccal total score and lingual total score divided by number of segments scored. And then oral hygiene index is calculated by simply adding up the debris index and the calculus index. Debris index and calculus index values range from 0 to 6, and since oral hygiene index is the total of debris index and calculus index, so its value ranges from 0 to 12. In case you have to calculate the oral hygiene index for group, then you have to divide the sum of indices determined for individuals by the total number of individuals. Now let's have a look at the interpretation. So the minimum number of points for all segments in either the debris or calculus score is 0. And the maximum number of points for all segments in either the debris or calculus score is 36. Since oral hygiene index is the sum of two indices, its range of values is from 0 to 12. And the last one is, the higher the score, the poorer the oral hygiene. Thank you for watching this video, and for such contents related to dentistry, please like, share and subscribe to Simplified Dentistry.